school, a couple people mentioned like, oh, she's pretty, but she has a crooked nose. So yeah, I was insecure about it. Over the past few years, I've met with other plastic surgeons that have good reputations in Minnesota. I didn't feel that any of them were confident in being able to fix it for me, give me results I'd be satisfied with, so I just kind of, I guess I tried to stop thinking about it for a few years, but it's bothered me. And after checking out Dr. Ghavami's website, I had noticed he had done quite a few rhinoplasty revisions, and I really liked the way his after photos looked.
So with her, one of the key things we see is she has a lot of irregularities with her nose. This side is completely different than this side. Her bone here is still prominent. Here you can see the detail of some bone sticking out, some edges here that are convex, and some bone and cartilage here sticking out. Her tip is long, droopy, and twisted to her left. And then she has a little bit of a residual piece of cartilage right here, which is bulging out, and then she has flat collapsed cartilage here. Internally, when I did her internal exam, I saw a lot of septal deviation that was untreated. Her turbinates are totally asymmetrically swollen, they're large. So what we're essentially gonna do is make the inside more roomier and bigger so she can breathe better, make the outside smaller, shorter, but not too short for her face, make the nose completely in balance. So, you know, we talked about everything in detail yesterday. There's not too much to review. I'm just going to kind of mark. And really the goal of this whole surgery is that not only will you look like you didn't have, you know, one rhinoplasty, you'll have two after this. So we talked about that twisting. Here you have essentially an area of collapse, okay? And here you have a bulging area right there. And then your bones are asymmetric, so I'm gonna go and give you more symmetric bone heights, bone angles, so that you essentially have bones that are the same. And we're also gonna put some cartilage in the rim to support the whole nostril rim, and so she doesn't have that pinched, twisted, droopy tip. I had to borrow a little bit of cartilage from the back of the ear, you can see here. So we kind of just sneak in, take a little piece, sneak out, and you can't tell a difference between the two sides of the ear. So you can see now she has a smooth profile. She's very swollen right now, but you can see this is going to be a smooth transition to her tip. Her tip is elevated, it's strong, it's not going anywhere.
I'm definitely happy with the results. I think it's pretty much what I expected, given it was a second rhinoplasty. I knew I wasn't looking for it to be perfect, but just a lot better than before, and just to look, you know, natural on my face without looking like I had another nose job. So, and I think I have those results. I think it looks great. 4 months is a legitimate amount of time to really be able to tell what's going on. Now, she was a complex revision rhinoplasty. So at 4 months, she's more swollen than a primary rhinoplasty would be at 4 months. But we can really assess the foundation of what's the changes have made and where it's going to happen and what's going to happen from here on. So if you look right now, from the front view, essentially everything is flowing nicely. Her tip in this area is probably 25% swollen still, and I anticipate in the next 3 to 6 months that's going to come down drastically. You can already see though how these contour lines from her eyebrows are coming down so nicely. Before, she had this large asymmetric area here. She had a collapse in here. Her cartilages and her nostril rims were very weak. And if you turn to the side, you can see the contour is good, and then turn to this side. You can see her profile curve is gorgeous. Now from here to here, that's the last part of swelling to come down, so I'm not surprised at all that she's still swollen here, but you can see how we brought her rims down and how elegant that rim is meeting the tip. I'm just not insecure about like certain angles as much anymore, like worried that, you know, from the side the tip looks crooked or there's a little bump that shows. So I just feel like it, from any angle, it looks okay, and I don't feel like people are looking at my nose. Like they probably just notice my eyes or my smile.
And when she smiles, this doesn't droop as much. Now she's a little heavy here because she's still swollen. So from here to here, really, it's gonna all come down and go closer to her face, kind of shrink wrap around the framework that I took so long and such painstakingly to try and rebuild for you. Her breathing's improved, and essentially all the goals we wanted to reach have been reached. Now it's just a matter of being a little more patient for that last 20-25% to come down.
I really liked those results because they looked really natural and they looked good.